Imagine diagnosing deadly diseases like tuberculosis with just a simple action. By simply recording a cough on a smartphone, this futuristic idea is now a reality. Thanks to Google's innovative AI tool, HeAR, this is possible. HeAR, which stands for Healthcare Assistant for Respiratory Diseases, uses advanced AI to detect illness through audio recordings. By coughing into a smartphone with the HeAR app, individuals can receive a preliminary diagnosis for tuberculosis in just seconds. This rapid, non-invasive approach can save countless lives, especially in areas with limited healthcare access and resources. HeAR's simplicity and accessibility make it an invaluable tool for healthcare workers in remote and underserved communities. With HeAR, a smartphone transforms into a powerful diagnostic tool, enabling timely and accurate diagnoses anywhere, bridging the gap in healthcare accessibility. HeAR detects diseases like tuberculosis and other respiratory conditions through a sophisticated training process involving millions of cough recordings collected from diverse populations around the world. Medical experts meticulously curated this vast dataset, enabling HeAR to learn the subtle acoustic signatures of different respiratory conditions, such as pneumonia and bronchitis. HeAR's advanced algorithms identify patterns in cough sounds that indicate specific illnesses, often too subtle for the human ear to detect. By comparing new cough recordings to its extensive database, HeAR determines the likelihood of a respiratory illness with remarkable precision, providing quick and accurate diagnostics. This data-driven approach ensures HeAR's diagnostic capabilities continue to improve over time, making it a transformative and reliable tool in modern healthcare. Tuberculosis, a contagious bacterial infection, remains a major global health concern, affecting millions of people worldwide, claiming millions of lives each year, particularly in developing countries where healthcare resources are limited. Traditional diagnostic methods require specialized equipment and trained personnel, often scarce in remote areas, making timely diagnosis difficult. HeAR offers a cost-effective solution for early detection and intervention, leveraging the ubiquity of smartphones to bring diagnostic tools to the palm of your hand. Early diagnosis through HeAR can facilitate timely treatment, reducing transmission rates and preventing drug-resistant strains from developing. HeAR's affordability and ease of use make it ideal for mass screening campaigns, empowering healthcare workers to screen for tuberculosis with unprecedented ease and accuracy, ultimately saving lives. HeAR bridges the gap in access to quality medical care, particularly for underserved communities. Traditional diagnostic methods often come with barriers like cost and geographical distance. HeAR leverages the widespread availability of smartphones, turning a simple cough recording into a powerful diagnostic tool. The affordability of HeAR amplifies its impact, making it a cost-effective solution for resource-constrained settings. By making accurate diagnoses more accessible and affordable, HeAR transforms healthcare delivery. HeAR empowers individuals to take control of their health, paving the way for a more equitable healthcare system. Beyond tuberculosis, AI bioacoustics has vast potential in healthcare. Researchers are exploring AI to analyze various bodily sounds, from heartbeats to infant cries, to detect medical conditions. Imagine smartphones detecting heart murmurs in newborns, or providing early warnings for conditions like sleep apnea. AI bioacoustics could revolutionize healthcare, making it more proactive and personalized. Algorithms can differentiate between normal and concerning infant cries, aiding new parents. As AI advances, expect more innovative applications in healthcare. AI bioacoustics promises a future of personalized disease monitoring and early detection. The potential of AI tools like HeAR in revolutionizing global healthcare is undeniable. Realizing this potential requires collaboration from developers, healthcare providers, policymakers, and the public. Google's decision to make the HeAR API publicly available fosters collaboration and accelerates new applications. Developers can integrate HeAR into existing healthcare apps, expanding its reach. Healthcare providers can integrate HeAR into clinical workflows, especially in resource-limited settings. Embracing AI-powered tools like HeAR can make healthcare more equitable, accessible, and patient-centered.